Hello, everyone. Good evening. Thank you for joining us today for Sukoon Ka Adda. Uh, Sukoon means peace, and that's exactly what we are here for. Our mission is simple to ensure that the generation of our parents and grandparents feel happy and at peace every single day. As India's most loved senior community, now spanning across 200 plus cities, Sukoon offers a space where seniors truly thrive, from friendly companions like our Sukoon Sarathis, who are always just a call away, to confidential counseling for emotional and mental well being. We provide unwavering support. Seniors find purpose through impactful volunteering opportunities as well. Thank you so much, everyone, for joining us today. I welcome you all again. The host for today's evening is Dr. Sapna Sehgal, our Sukoon star of the evening. Thank you so much, ma'am, for joining us. About Sapna, ma'am, with over 30 years of experience as a physiotherapist, she's dedicated her career to helping achieve optimal well being. She specializes in orthopedic physiotherapy with a focus on geriatric care and women's health. She is definitely a perfectionist. So you guys are definitely at at the right place. Over to you, Sapna ma'am. Please do let me know as in how you want me to share the screen.
Thank you. Thank you so much, Priya. And thank you, Sukoon, for inviting me today to share my knowledge. So, our theme for today is how do you boost your health with physiotherapy? Priya, can we have the first slide? So, let me start by defining health since we are talking of health. So, WHO says that health is a state of complete physical, mental, and social well being. That is how WHO defines health. Now, to this statement, though it's very wholesome and it's complete, but I would like to add one more aspect of health, which in my experience is very important. So, health, according to me, is also the ability to lead a functional life of your choice. Now, what I mean by that is if I want to go trekking, and since we were talking of age in our earlier conversations, if I want to go trekking at 60, what can I do to ensure that I am able to do that? So, and how can physiotherapy help me with that? And if my goal is to just play with my grandchildren, then what do I need to do from a physiotherapy perspective to be able to do that? So most of us actually, we wait for the right moment, the right time to start looking after our health. And we think we'll do it when certain responsibilities are over or when I have more time. But these life altering changes, they don't happen by magic. It's the small, daily, boring habits that lead to a good health. So I'm going to dive a little deeper into it. Can we have the next slide, Priya? So, disease or wellness? That is the question. So, by and large, we look at medicine from a disease management perspective. And if I go specifically to physiotherapy, Priya, the next slide, I'll go on to who needs physiotherapy, who goes to a physiotherapist. So either for pain management, so generally people with back pain, knee pain, frozen shoulder, after surgery rehabilitations, injuries, after a fracture. So by and large, physiotherapy is seen as a short-term treatment to manage the current problem at hand. Can we have the next slide, Priya? So there is mobility, which is stiffness of joints, which happens as we grow older. Rehabilitation, as Deepa was mentioning earlier, after a stroke. And I want to introduce a new concept and a new approach of looking at physiotherapy. And that is how do I boost my health and not have to go through physiotherapy for all these issues? What can I do and how can a physiotherapist support me on that? So for the purpose of understanding, I'm going to divide it into two categories. So the first category of physiotherapy is all these above, which is pain management, mobility, rehabilitation. For the second part of, or the second aspect of physiotherapy, let's go back to the WHO definition, which was physical, mental, and social well being. Can I have the next slide, Priya? And I'm saying there's something in it for everyone outside that. So if you have better sleep, which comes with exercising, if you have a good bone density, your weight is under check, your diabetes is managed with exercises, your blood pressure is controlled with exercises, your cholesterol is managed with exercise, then you're contributing towards your own health and you're boosting health and wellness. Now, it's easy to say this. The question comes now, what kind of exercises will work on each of those aspects that I have just enumerated of sleep, bone density, weight management. And Priya, you mentioned about perfectionism. This slide I wasn't very happy with because it seems off, but it drives home the point that there is something in it for everyone. So I'll be talking about certain beliefs. Can I have the next slide, Priya? And now, if I want everyone to have a look at this, and I'll open the mic for everybody, and we are going to discuss what is a myth, what is a fact here. So, good participation we need here. How many of you over here believe you should not bend forward if you have back pain? Can we do a quick poll here?
You must try to do it. Uh, you should, as much you exercise and you attempt, that is going to be better for you. That is my principle.
Okay, but do you think you should bend forward if you have back pain?
Mm, I do believe some sort of exercise is always necessary. Maybe you don't bend too much, which will aggravate your injury, but at least continue to do some effort so that you just increase the longevity in doing something or other.
Okay. Is there anyone else who'd like to share their experience around them not bending forward when they had a back pain?
See, what we have been told is if you bend your knees while you are bending your back, that's
Mm-hmm. That's okay. All right. All right. Is there anyone else before I?
Yeah,
I
I have been led to believe that you should not bend forward if you have back pain, definitely.
okay. So now,
The gentleman very rightly said, bend your knees to go down to pick up something or other. I have been specially doing on recommendation of my trainer, and it has really helped me in last 6 months.
so which is what I'm understanding here is that you're not bending forward
Mm.
and you're bending your knees to do the movement.
Yeah,
Is that correct? Okay. So now the body has been designed for movement. There are very few back conditions in which it's an absolute no-no to bend forward. The basic principle of the body is use it or lose it. If you do not use a certain joint, a certain muscle, or a certain organ of the body, over a period of time, you're going to lose that function.
that's
So,
what my first point I mentioned. You should
yes, yes.
continue to use it, then only it will function.
Yes, yes, I completely agree. So for most back pains, but on the popular belief is that if you have back pain, you should not bend forward. So the point I'm trying to make, and which is why it comes under this myth versus fact, it's actually a myth. It's not a fact. If a back pain, if a spine is unstable, only then you should not bend forward. Otherwise, movement is essential. Movement is essential for our body. It's a basic structure that the body requires. And I'm going to just bring a little model of a spine here. Every joint is designed for movement. Now, when you stop moving it, it leads to cumulative stiffness. So it is absolutely essential to continue moving. Let's come on to the next one. Should you wear a belt or a lumbar belt if you have back pain? Anyone with an experience of using a lumbar belt here?
Yeah, I once had, this is a few years ago, I once had back pain and lumbar belt helped me. But I would wear it sparingly, like I'm a teacher. So while I was running around in school, I would wear it. And definitely it gave me relief. But I wore it
Okay,
for a short time, not long term.
right. Anyone else would like to share?
Particularly helpful during winters.
Gives the warmth. Okay, so a lumbar belt is an immobilizer. It's like a cast after a fracture. So, initially, if you do not want the muscles to move or you want to give it an extra support, a lumbar belt is a good option. But if you use it for very long, the muscles which should be working, and they are these postural muscles, which have to be very, very active. So if they stop working, they get deactivated and they weaken over a period of time. So a lumbar belt used indiscriminately for a very long period is not a good option in terms of the health of your spine. So I'm going to go on to the third one. Pain is a side effect of aging. Is that true?
I don't agree.
Okay, wonderful.
You continue your exercise, it will help you. I've done 3 years of post my retirement. I'm doing almost last 2 years. I do, I had before my retirement lots of, stiffness. My legs used to wobble and I was not able to bend. I started exercising. Now my legs are strong. I'm able to walk through any place, even climb a slight steep thing, and I have no issues. And putting a belt or other thing, this will only restrict your muscles. Nothing else will happen.
Right. So what I'm hearing from you is that pain is not a side effect of aging.
Yes, I agree.
Okay. So is there anyone who thinks that it comes with age, that some aches and pains will be there? Oh, wonderful. So I love the audience does not believe, because actually pain is not a side effect of aging. Pain is a body's response to some kind of an injury or inflammation, even deficiencies for that matter. Vitamin D deficiency will cause pains. Environmental factors, most of us are now addicted to our phones, to our screens. We are bending forward. All this is causing tightness in the muscles. That leads to pain. So, these are the areas of pain. Psychological factors. Every time you're stressed, you're depressed, it releases cortisol in the body. Cortisol is also going to cause more pain. So, this accepting pain as a byproduct of aging is not a truth. It's a myth that we need to bust. Um, Bed rest is the best cure for orthopedic problems. I
No.
know, sir, you have been saying that movement and exercise, and you're my ideal patient.
Yeah, there is no question. Bed rest, you see, you have to be, that prescribed hours is 7 to 8 hours of sleep. Beyond that, you should not be in bed. You should be moving, doing something or other. That is the only way to build up for the rest of part of your life.
Can I take a testimonial from you and put it on social media? So I
Yeah,
have patients
please
who
add my
come.
chat. I have given some information in the chat. Please read
Okay,
it.
I will. I will. So
So many times, so many times if I sleep for longer, like winter, you don't feel like getting up in the mornings. So you laze and my body starts becoming stiff and hurting. When I get up and start moving, the pain disappears.
Wonderful. Actually, when the belief is that resting is a cure for pain, it leads to a whole catch-22 situation. Because mobility also brings nutrition to the joint.
Yeah.
It increases the blood flow. So when you're not doing all those things, you're actually causing yourself more harm. So when patients come and they just want to rest out, this is where this statement is coming to bust whether it's a truth or it's a myth. So I'll come on to the next one, which is cracking of the joints. So a lot of people feel that every time a joint cracks or pops, it's a setting in of arthritis. And there is a belief around that oh, it's cracking, so I have arthritis. In most cases, it's just the popping of the carbon dioxide. If that cracking is associated with pain, then most likely there is nipping of some cartilage which is causing that pain, certainly not just the popping sound. So cracking of joints is not a like a predecessor or precursor to arthritis. The next one that I have on this list is something that I'm asked all the time, whether to use a pillow for neck pain, cervical spondylitis or not. Priya, can we have that slide, please? Okay. I'm going to ask all of you to have a look at this, and then I'll talk a little more about this. If you're a back sleeper, and I'm going to go back to my model, this is the spine in the
Excuse me,
sleeping
ma'am.
position. Yeah.
Can I intervene?
Yes, of course.
When I sleep, I suffer from vertigo. And
Okay.
when I change my position, it becomes worse.
Hmm.
Then I
Okay.
stop for some time. Then when I get up, then I have to sit again because my head spins. Vertigo.
Can I answer this question at the end, ma'am?
Okay.
Yeah. If you can
Yeah.
just put a note, and at the end we'll be. I've kept aside time for the question answer. But
Yes,
because we were talking of the neck, I'm sure this is what came up for you. But let me just go on to the basics of a spine curve. If you see this, this is how you are if you're sleeping on your back. So there is a concavity here, there is a convex curve here, and in the lower spine again there is a concavity. Now, if you're a back sleeper and you look at the image on the left, the spine has to be straight when you sleep. So your pillow should be of the right height to allow that neutral position to come. If you're using a very high pillow, your neck gets pushed up, puts a lot of stress. If you're using a very thin pillow or no pillow, then the neck is hanging down. Again, there's a point of stress. Now, this is if you're a back sleeper. If you're a side sleeper, this curve again. Now, I'm going to just demonstrate here the curve. This gap needs to be filled if you're a side sleeper. So, if you look at the diagram again, the straight line happens with the right height of pillow. So it's like buying your right size of shirt or footwear. If you're a size 38 and I ask you to wear a size 40, you'll float in it. If I give you a smaller size, it'll be too tight for you. Same is with your pillow. You have to take the effort, make that effort of finding the right height of pillow for yourself. If your pillow is too high, again, you see on a side position also, the neck is pushed up. Too low or no pillow, either it's hanging down. Most people end up putting their hand. So the next question that comes from this is, which is, and I'm sharing from what I'm commonly asked, what kind of pillow should I use? A pillow that is firm enough to keep your neck in that position. A very soft pillow with the weight of your head is going to sink in. So it serves no purpose. You have to bring your spine to a neutral position to get the right support that you need. These are postural muscles and they only get rested when you lie down. Otherwise, they are anti-gravity and they're working all the time. So overworked muscles are also going to hurt. So finding the right height of pillow is an absolute must. And this little exercise of finding this position, all of us should do. Priya, can we have the previous slide, please? Is there, Priya? Yes. So, yes, thank you. Is there anyone who has any doubt on the pillow? Please make a note of a question and we'll answer those later. So the next thing I hear very often is that knee pain runs in my family. And knee pain coming from degenerative changes, which is osteoarthritis, which is the most common kind of knee pain. It has no genetic predisposition.
I
Only
think it is a wrong statement.
Sorry?
You have to walk, and it is a wrong statement. You
Yes,
have to
yes.
walk, your knee will be fine. I'll
So
just
no,
give an
sir.
example of my father who
Yes.
has walked so well. He is now 90 years old. He's still able to walk and get all his things done on his own. He is not dependent on his grand or great grandchildren for anything.
Wonderful, wonderful. So the only thing I'd like to talk about when I'm talking of knee pain is that degenerative pain is more to do with us. So if you're when you walk, every step you take, there is a ground reaction. And that ground reaction is 1.5 to 2.5 times your own body weight. So there is an action where your foot hits the ground. There is a reaction from the ground which goes back towards the knee. So if you are overweight, just starting from there, the ground reaction is also going to be more. So it's nothing to do with your genes or running in the family. It's your weight which is causing the knee pain. The second most common thing is footwear. If you're flat footed, which means that your foot arches are dropped, then also the ground reaction goes to the knee joint. And the simplest solution for something like that is to get arches like this. And these arches have to be customized to your pressure, your foot pressure. So there is a device which is a foot scanner that gives an imprint of where your weight is being borne. Based on that, you can get arches made like this. This lifts the foot if you're flat footed, and that takes care of the distribution of the weight on your knee joint. Having said that, some wear and tear is going to happen. It's a machine at the end of the day. There is cartilage which is holding the joint in place. As we go about life and as we grow older, this cartilage also becomes thinner. So there is a lot of rubbing that happens. But not all knee pains are coming from a genetic predisposition. Sorry, sir. You were saying something? Can I move to the next one, please?
Yeah.
Okay. Hot versus cold. Best remedy for pain.
Many times hot helps and sometimes cold also helps.
So just to get an idea of what to put where,
Yeah.
because heat is soothing and that is our first reaction to
Yes.
any kind of pain.
Yes.
But acute muscle pains will get better with cold therapy. Chronic joint pains, nerve pains, they respond better to heat. So next time you reach for that hot water bag for a pain, ask yourself, what pain is it? Is it a muscle pain? It's a chronic pain. It's a acute pain which has suddenly come, a nerve pain, because not all pains respond to heat. Heat and sometimes makes it worse. especially when you've had an acute pain, like a sprained ankle or a sprained wrist. That responds better to cold. So the last one on this list is I'm too old to lift weights. Does anyone believe that?
Yes, I am believe.
Yeah, you think too old to lift weights?
Oh, yes.
Okay. So there's a very interesting physiological
I am
phenomena.
63 years old, and for the last 2 years, I'm doing chest push of 30 kgs, leg pull and
Hmm.
leg extension for 35 kg, weight lift
Hmm.
of 35 kg. I'm more active now.
Fantastic. So that's
I'm
because,
also I'm also more active.
okay,
I'm
but not
also
able to lift weight.
like not leg pain. I am not leg pain.
Okay.
I'm lift weights.
No, but they say that you suffer loss of muscles after 55 years of age. Unless you
That's correct.
take some weight, then only your muscles will add.
That's correct. That's correct.
Yeah,
And
yeah,
the
yeah.
good part of this is that the muscles do not know whether you're 8 or 80. They will respond if you make them exercise.
Still
So,
maintaining my weight. Weight 60, 62. Still, I am
ma'am,
60, 56.
it's not about the weight. What happens
Oh,
is over a period of time, the muscles shrink in size. So you may find that even though your weight is the same, the girth of a muscle has reduced. So there may be hollowness in the shoulders. You may find that. That's a very common space to see. If you're
yeah.
diabetic, then there is diabetic myopathy, which is that the muscles lose strength. So weight training is very essential as you grow older. Some one muscle, which is the biceps, this is the front,
Okay.
has some 2.5 lakh fibers. Every
Okay.
muscle has these fibers in it. And these fibers, they slide over each other when you do certain action. Now, in normal day-to-day activity, we end up using only 1/10 of those fibers. As you grow older, the muscles, because they haven't been used, and what you don't use eventually will shrivel up and it will shrink. So when you start training the muscles, at whatever age you may be, they start responding by becoming bigger in size. They become more mobile. So the gliding of these fibers becomes better. So you are able to build muscle. You'll realize you can do a lot more with more strength.
Uh,
Okay.
can I give you
So,
my experience? I started off when I retired in 2022. I was around 90 kgs. After I started doing exercises and going for good diet and everything, I came down to almost 84 kg. Now I'm
hmm,
about 88 kg.
okay. And
So,
you started weight training.
yeah,
So there's an example. What else can I say?
that the muscles have developed.
Yes.
That's what I want to say.
Can we see your biceps, sir?
Yes.
Uh,
uh,
Dr. Sapna, what should be the frequency of weights that we do in a week?
Okay. Yeah. So, Priya, if we can have the next slide, I'm going to talk about that.
I was wondering,
The next one, the
could I
fit.
ask a question? Could I ask
Uh,
a question?
yes, sure. Go ahead.
I have found that I have had two angioplasties,
Okay.
one 17 years ago and one more recently. Now,
Right.
I found, and I had a surgery even before that. I found as the number of, these surgeries and so on went up, one's capacity to, lift and take weight upstairs and such other things has decreased. The
Hmm.
stamina.
Hmm. Hmm. Hmm.
I can't, for example, climb up railway station, those steep steps that are there,
taking weight. I can go up and down, but I can't, take my luggage along. That becomes a handicap. So what would you like to say about that? You are
Okay,
saying that
this slide, if you have a look, and I'll be talking a little bit more about this. So there is this fit formula, and this double T is not a grammatical error. The first letter F stands for the frequency of exercise.
Physiotherapist hai, 30 years experience.
So the frequency of your exercise is, and I'll come to that. I'm saying every day you should be exercising, but a different set of exercises so that you're able to use all the muscles in different ways. You're able to get the best out of your exercise. After this, I'm going to be sharing a little calendar, like an example of what exercises types we need to do. So coming to the first F, which is the frequency of exercise, every day, but a different set. Let's come on to the next one, which is the intensity of exercise. The intensity is the one basic formula that you can use, which is an easy formula, is your heart rate has to go up when you're exercising, but to what extent? And since, ma'am, you shared about your angioplasty, for you specifically, you should be exercising based on your heart rate. So the formula that goes is 220 minus your age, and for a moderate exercise, it should be 60 to 70% of your maximum, that the number that you got earlier. So I'm going to give you just an example. So if you're 62, 220 minus 62, that number is your maximum heart rate. That 60 to 70% of that maximum heart rate, which means your heart rate should go from 94 to 110 at the end of your workout. So that should be the intensity of your exercise. Too little, not doing enough. Too much is harmful. Your body may not be able to bear that. So next time you are even going for a walk also has to be at a certain pace with a certain cadence. So make sure you're able to measure your heart rate. The simple thing, just the pulse, and that will give you an idea of what is the intensity at which you are exercising. The third part of that formula, which is the T, which is the first T is the type of exercise that the time of exercise that you should be doing. So if you're doing a moderate exercise, 45 minutes to an hour is enough. If you're doing mild intensity exercises, then it has to be about 60 to 75 minutes. So that is as far as the duration when I wrote the time. The second part of it is a type of exercise. So when I say type, there's a whole plethora of exercises. Cardio, strength training, which one of our colleagues over here, and he has been doing a lot of strength training and building muscle. Balance training, which is another very important aspect as we grow older. Lung rehab, because the lungs also lose capacity. And ma'am, what you were saying, I'll come back to that. All these are required for us to make our workout complete. So I'm going to go back to the fit formula. And can we have the next slide? And we'll talk a little bit more about, if this was one broad exercise calendar that you had, where you're doing cardio twice, you're doing your weight training twice, you're doing your lung rehab twice, yoga and stretch, which is also very essential. balance exercises, this becomes like a wholesome exercise plan. It's like making a dish. You're preparing some vegetable. You need the vegetable, you need a cooking medium, you need salt, you need haldi, you need garam masala. Only then will you get the perfect dish. So you need some element of all these in your exercises to get the perfect health. On that note, I'm going to open now to questions. Ma'am, can we go back to your question? You spoke about you not being able to climb steps, and after your angioplasties, and you found that with subsequent surgeries there is a loss of strength. Am I correct in understanding what you asked, ma'am?
I am able to climb stairs. That's not an issue. But
Okay.
climbing stairs, carrying weight of maybe 10 to 15 kilos, which is the typical luggage that you take with you when you go away for maybe 4 or 5 days on maybe official or personal travel. Now
Right.
that is an issue. That is an issue.
Okay. Okay. So now to be able to carry weights, one, you need to do strength training. Start small, build it up. You also need to do lung rehab, because that is, your breathing has to be right to be able to get the nutrition when you're doing the strength training. So I'll be happy if for you to reach out to me later, and we can go on a call and discuss how to make your plan, because I'll need some information from you before I make an exercise plan for you.
Okay, thank you.
मैम एक क्वेश्चन
Yes.
मैम मुझे तबीयत में कुछ प्रॉब्लम नहीं है, ये शुगर नहीं, बीपी नहीं, कुछ नहीं है अभी, ऑपरेशन भी नहीं है, 2 बच्चे का अच्छा हुआ, इसको बाद कुछ नहीं है। बाद में 2 साल का पहला नीचे गिर गया, ऊपर का पीछे का थोड़ा तकलीफ ही हो गया, मुझे तकलीफ हो गया तो उसको गैस है ना, जब आगे आगे का एक जगह में पेन हो रहा है, दूसरा जगह में वापस पेन हो रहा है, ऐसा एक ही जगह में नहीं है पेन। मतलब वो डॉक्टर ने बताया वो मी करके एक टैबलेट वो खाने के लिए बताया मेरे को, वो तो खाई खाओ तो खाली पेट में खाई खाओ थोड़ा अच्छा लगता है। ये तो कैसा अभी दवा नहीं है, दवा नहीं चाहिए, दवा नहीं तो कैसा करने के
तो आप ये कह रहे हो कि आप गिर गए थे?
गिर गए थे, ऊपर से गया, ऊपर माला पे ऊपर स्टूल में नीचे गिर गया था। तभी
अच्छा।
एक घंटा है ना, मुंह में आंख में है ना हवा आ गया, ध्यान नहीं है मेरे को, मुझे ध्यान नहीं है। तो उधर डॉक्टर के पास लेके गया, डॉक्टर बस लेके गए टाइम अभी उन लोग कुछ नहीं है करके, फ्रैक्चर नहीं हुआ, कुछ नहीं हुआ, मुझे कुछ नहीं, भगवान को ऊपर, भगवान का कुछ नहीं हुआ। अभी है ना वो हवा पकड़ किया बोलते, गैस पकड़ किया बोलते पीछे गैस पकड़ गया तो मेरा तबीयत अच्छे था, मैं कितना वजन है उतना उठाएगा, मैं अभी मेरा 56 ईयर्स हो गया, कितना वजन उठाएगा अभी ये नहीं, अभी 2 साल का पहला थोड़ा थोड़ा धीरे धीरे अभी इतना सूजन हो गया पीछे से, वो सूजन नहीं अभी एक जगह में रहेगा, दूसरा जगह में पेन हो गया, दूसरा जगह में जाएगा। अभी मैं एक 6 महीना का इधर एक मंदिर में गया था, मंदिर में जाके आने के टाइम स्पीड ब्रेकर में बस ऊपर चला के नीचे गया, तभी वो तो गए, वो भी गए, वो भी दूसरा गए में वो तकलीफ ही देगा। फिर भी क्या, मैं रास्ते में जाने के टाइम थोड़ा बर्तन साफ करने के टाइम थोड़ा ऐसा रोबो के जैसा रहने पड़ता मेरे को, रोबो के
बॉडी
जैसा रहना
स्टिफ,
पड़ता,
आपको स्टिफ रखना पड़ता है।
स्टिफ करना पड़ता है, वो तो थोड़ा दर्द हो रहा है उधर, पीछे का थोड़ा दर्द हो रहा है, यही प्रॉब्लम है मुझे। ये प्रॉब्लम बराबर हो गया तो मैं चाहिए थी इसके क्या करने के मुझे।
ओके, क्योंकि आप जो डिस्क्राइब कर रहे हो फ्रैक्चर नहीं था, पर कहीं पे सॉफ्ट टिश्यू इंजरी तो हुआ होगा जब आप गिरे हो। उस सॉफ्ट टिश्यू इंजरी में बॉडी में कभी कभी जैसे एक एडहेजन्स बन जाती है। एडहेजन्स का होता है जैसे एक नेट होती है, जैसे कोई एक जाली होती है, तो जाली में इस तरह से एक के ऊपर एक ऐसे करके चिपक जाता है, वो मसल ही होता है। वो
Okay.
एक इन्फ्लेमेटरी एक्सुडेट बोलते हैं हम उसको, जिसमें जब कोई इंजरी ऐसा होता है तो सॉफ्ट टिश्यू की इंजरी में वो मसल फाइबर्स चिपक जाते हैं।
Okay.
उसके चिपकने से भी आपको ये पेन ऐसा हो सकता है। पर जो आप स्वेलिंग
Okay.
बता रहे हो, वो
अभी
स्वेलिंग
swelling
अभी
नहीं
तक,
है,
अच्छा
अभी
अभी नहीं,
swelling नहीं, अभी नहीं है, अभी
क्या
नहीं है
आप
swelling नहीं।
क्या आप मैम खड़े होकर के आगे झुक सकते हो? एक बार आप अभी
झुक-
खड़े होइए जरा।
एक
आप आगे थोड़ा स्क्रीन पीछे रखना ताकि मैं आपको देख सकूं।
मिनट में रखेगा। हम्म, अभी मालूम पड़ता है?
हाँ,
हम्म,
आप आगे को झुक सकते हैं।
हाँ,
इसमें आपको
वो तो
कोई
बराबर है।
तकलीफ, हाँ, और कोई तकलीफ नहीं है,
वो तो नहीं
कोई
नहीं है,
तकलीफ नहीं है।
अभी चलने
अब
के
आप
कर
पीछे
हाँ,
अब आप पीछे को झुको एक बारी। आप इस
कैसा
तरह
कैसा?
से, आप ऐसे पीछे को झुको।
हाँ, होते इधर का बयस
इधर
थोड़ा
दर्द
थोड़ा सा
होता है। हाँ,
थोड़ा सा ना, इतना नहीं है,
ओके।
थोड़ा सा रहता है। हाँ,
आपका जो प्रॉब्लम, जो सिर्फ इससे जो मुझे अभी समझ आ रहा है कि
ओके
सॉफ्ट
ओके,
टिश्यू ही इंजरी होगा, पर वो सॉफ्ट
हाँ,
टिश्यू इंजरी से अभी तक मोबिलिटी आपका वापस बैकवर्ड में नहीं आया है। आपको
ओके
एक्सरसाइज करना चाहिए। आपके घर
ओके
के पास में कोई भी फिजियोथेरेपी क्लिनिक हो, आप एक बारी जाके वहां पे रिव्यू जरूर कराइए। और आप चाहें
ओके,
तो
ठीक है,
एक बारी आप सुकून से मेरा नंबर भी ले सकते हैं और एक
ओके
आराम से वीडियो कंसल्ट कर लेंगे।
ओके, ठीक है ठीक है ठीक है, थैंक यू।
Yeah. So somebody had asked about cramps. Somebody had written about cramps.
I have asked
Cramps,
for them.
sorry?
I have asked for
Okay.
issue
Okay.
related to cramps.
Right.
Actually, someone suggested vitamin D and magnesium. Someone else suggested vitamin E, but I'm not finding any uh, correct solution.
Sir, I'll tell you the single most reason of cramps is lack of water. You're not drinking enough water. This is one
Okay,
of the commonest causes of cramps.
okay,
That is one. Second is, even so, if your salt intake is very low, so there is a sodium potassium imbalance in the body. That is a second cause of cramps.
okay,
The third, since you have mentioned about your fitness routine, when
yeah,
you're doing very high intensity weights, you must spend a good amount of time stretching.
okay, okay,
If you're not stretching enough, there is a lactic acid buildup.
okay,
So if look at these three things
okay,
and then look at other things.
okay. How
Yeah.
to? I do have a level of potassium slightly higher, so you recommend and I do take 1 or 2 cups of coffee with milk. Will that should be the cause?
No, no.
Okay, okay.
So there's somebody who's asking about not being able to sit on the floor. Now, sitting on the floor requires a lot of mobility, not only in the hip, knee, ankle, but also the spine. So to be able to sit, you need to make sure that all these joints are flexible. So a good stretch regime will help.
Okay. Oh, excuse
So,
me, Dr. Sapna.
yeah.
So what you are suggesting is that our daily exercise routine, besides walking, should be a combination of stretches, weights, and a little bit of few yoga asanas, if possible.
Yes, yes. And also lung exercises.
For
Lung
yoga,
exercises.
you have to sit on the
It's,
ground, no?
is it
Sitting up
is it okay if you do? It's not okay if you do weights one day and then you do some asanas the next day.
No, that's all right. That's all right. In
That's
fact,
all
that
good.
was the calendar. That was part of that you make it possible for you to do. You can't do everything in one day.
Yeah, it's not possible. That's what.
So keeping in mind that we have say 45 minutes to an hour that we are able to devote to exercise, and we want to add a little bit of everything. You add yoga, you add in that, if you want to add the lung rehab, you can include that. You should also be using weights to get strength. Cardio is as far as walking is concerned, or any other form of cardio that you like, and
Okay.
balance exercises.
Balance exercises.
Yes.
Okay.
Ma'am, you were saying something.
The ground, I feel that there's no strength only.
Hmm.
That's the problem.
So, ma'am, are you able to sit? But strength is
Yeah,
one thing. The
yeah,
joints are flexible.
yeah. But when
Joints
I go down,
flexibility is not an issue.
not an issue.
So
No,
it's a
I
lack
feel
of
that,
strength then.
okay. So
So
what
then you
exercise
should
should I
work.
do? How should I?
Yeah. So before I tell you
Yeah,
what
I
exercise,
try to go down a little. Every time I try to go down a little, but I cannot go down to the ground. And when I go down to the ground, then I cannot lift myself
come up.
up again.
So your knee strength, probably knee and hip strength, is what needs to be worked on. We could do a separate call. I could also share some exercises. I don't know whether Priya, do we have time?
How much time will it take, ma'am?
We can do a call separately with ma'am.
Acha, no, ma'am. If you demonstrate the exercise now, how much time would it take? How much
It would
time more do
take,
you need?
I could take maybe about 10-15 minutes. No, we could do it faster also. You tell me how much time do we have?
Ma'am, only 5 minutes.
Oh, okay.
Plus, there are
Okay.
also other questions pending.
Okay. So then I'll be happy to send maybe a video of some exercises, and you
Or
can
we
share
can
with them.
we can also keep a follow-up session
Sure.
in coming
thanks.
weeks. That we can do.
We'll do
Okay?
that. So that session can only be in an exercise session.
Correct.
Okay.
We'll do that. We'll do that.
Perfect.
Okay.
Very
Okay.
sorry,
So
Habiba ma'am.
No, it's
okay.
okay.
No,
Thank
someone had
you.
also written in the chat that they have developed a pillow.
Bhayana sir. Bhayana sir.
Yes, madam.
Yes.
Yes, madam. Yes.
Yes, sir.
Madam, I have developed a pillow which is more suitable for the side sleep.
Oh, wonderful, sir. I would be very happy to see it. If Priya can connect us,
Okay.
I would love to see your product,
Thanks a lot.
and it would mean a lot if I can use it and recommend it.
Thanks a lot, madam.
Is it based on the principles that we were talking about, sir?
Yeah, absolutely.
Oh, wonderful, wonderful. I'm very keen to see your product now. Right.
Ma'am, can I ask a question?
Yes.
Ma'am,
Okay.
doctor, the problem with me is my lower back. When I stand for a long time, there is kind of a fatigue, pain on the left side. Pain, not as in pain, but some kind of a muscle fatigue like. And it goes if I sit down and then I bend forward, and then in 5 minutes it's gone. But every time I stand to cook or to wash vessels or whatever, the pain crops up. So what do you suggest I should do? Go to a physiotherapist and do, or what should I do?
Yes, ma'am. What you're describing is a very typical condition, if curve, that I was talking about, because these muscles in front, the abdominal muscles, have become loose.
Yes.
This is the commonest cause. So core exercises help with that. But there is one more condition that causes that. So I would recommend that you see a physiotherapist. You'll need an X-ray for that. Because there's one condition in which there's a slight malalignment of the bone that also causes a similar thing.
Is it the spinal X-ray you're asking for?
Yes.
Spine
Yes.
X-ray? I did
Yes.
one. Nothing showed up as such there some 2 months
Okay.
back. There was
All right.
nothing
Then in
abnormal.
all likelihood, it's only the weakness of the abdominal muscles. You need to strengthen your core. The body's pillars of support are the
Mm,
abdominal muscles, the spine in the center, and the back muscles.
mm,
Now, all
yeah.
three have to be absolutely strong for it to hold the rest of the structure in place.
Mm,
And
yeah.
with women, especially after childbirth, these muscles become so loose that it's
Mm,
like an overstretched elastic.
yeah. Correct.
Sangeeta ma'am, you raised your hand. Please ask your question.
Yeah, Dr. Sapna, I just wanted to know, I'm quite agile otherwise. I don't have too many aches and pains. I'm doing yoga daily, but I'm not doing any of the others. I feel slight breathlessness when I climb the stairs. And also when I get up after sitting, there's stiffness in the knees.
Hmm.
So it's probably lack of exercise. I would love for you
You
to
know,
design a set of
yes,
exercises
I'd
for
be
me.
happy to,
I
walking
promise
in
to follow.
itself. The accountability will have to be there. See, walking is an exercise that all most people enjoy, but it's not wholesome.
I find it very boring, ma'am.
So what is your go-to exercise?
I used to play a lot of tennis and I was very active. I find it quite. I bought myself a bicycle 4 months ago. I have yet to inaugurate it. So I think
That's
that
it.
would
That's
be.
it. Okay. Oh, so you said you don't walk because I thought you said you walk daily.
No, I'm quite agile, I said. I'm
Oh,
active.
agile. Okay. Okay. So what you're then describing is really a lack of exercise. Remember, we spoke about the wholesomeness of things. Use the exercise that you've bought. It'll help you build strength and stamina both. It's a good form because you can increase the resistance. It helps in building strength also. If you loosen it and you go on to the time part, then you're building your endurance. So an exercycle is a good thing to do.
No, I have a bicycle.
Oh, like a bicycle. Better
Yeah.
still. Better still then. But you will need to put it to let it hit the ground.
And I'd love to consult you and get an
Sure,
exercise
sure,
program.
sure, sure. I'd be happy to help you out. I'd really be happy to help.
Thank
Okay.
you. And I promise to follow.
Okay, thank you, Sangeeta ma'am, for keeping it quick. Next is we have two more queries and we are wrapping up after this now. Mahesh sir and Rajni ma'am, please kindly keep it quick. Rajni ma'am, please unmute yourself.
Hi, hi, ma'am. Good evening. Ma'am,
Hello.
I myself, Rajni Bhagat from Varanasi, I am speaking. And my main problem is knee problem.
Mm-hmm.
I don't have pain in my knees, regular pain I don't have. But whenever I sit downstairs, मतलब नीचे बैठ जाती हूँ तो ऊपर खड़ा होना या इवन मतलब from getting up from पलथी मारो to gets difficult for me.
तो जो हम पहले बात कर रहे थे कि हमारे जॉइंट के बीच में एक कार्टिलेज होता है जो
हाँ,
लुब्रिकेशन होती है। तो
yeah.
जैसे हमारी एज बढ़ती है वो लुब्रिकेशन कम होती जाती है, कार्टिलेज भी पतला होता जाता है और ये नॉर्मल वेयर एंड टेयर है। कई लोगों में ये वेयर एंड टेयर ज्यादा होता है। तो
So
जब हम चौकड़ी मार
do you think it is because of my CA? I am a CA survivor from 2003.
No, it is not because of that.
Not because of
No,
chemo.
no. So it's degeneration, but what you can do, is when you exercise regularly for your knees, you'll find that the nutrition to that area improves. And I'm not going to say that it'll go away completely, but exercise will help it.
Exercise I do regularly. Knee strengthening I do regularly.
The one exercise that helps in improving the circulation is the isometric knee exercise.
Okay.
So that exercise, maybe in the follow-up session that we do, I'll demonstrate that exercise. Priya, if you can take a note, and then we can work on those exercises.
Sure, ma'am. I will do every day because I wake up at 5:30 and do my exercises, knee exercises
Right.
especially.
Right. But the isometric is one exercise that helps specifically for the lubrication part.
Yeah, okay, ma'am. Okay, ma'am. Okay, ma'am. Thank you. Thank you so much, ma'am. Thank you so much.
All right.
I'm worried
Okay.
about my knee.
All right.
Thank you, ma'am.
Having no other problem except my pouch. Want to reduce on my body. Weighing too much. I do pranayama and all other exercises, but not stretching. Stretching I don't do. I can sit down on the floor, etc. That's not a problem. The only thing is what are the things which I should do that will I just want to just want to reduce by at least about 25 kg.
25 kg?
I can yes. So that's why if Sukoon can give me your number, I would like to talk to you in a detail.
Sure. I'd be happy to help, sir. My number is with Priya and she can share it. And if you can
Please.
message me, we can set up a separate call.
Chalo, we will wrap up now. Thank you so much, Sapna ma'am. What a wonderful session. Maza aa gaya.
Thank you very
And
much.
Thank you, Priya, for
Wonderful.
inviting me, and thank you, Sukoon, for the wonderful work that they are doing.
Good
thank
night.
you,
Priya.
everyone.
Thank you very much.
Thank you,
Thank
Priya.
you.
Thank you.